The medial head of the gastrocnemius originates at the proximal and posterior part of the medial condyle and adjacent part of the femur. It also originates on the capsule of the knee joint. The lateral head of the gastrocnemius originates at the lateral condyle and posterior surface of the femur and the capsule of the knee joint as well. Both of them insert on the medial part of the posterior surface of the calcaneus. When manual muscle testing the gastroc, the patient is prone with their knee extended. Hand placement is then going to be on the anterior aspect of the tibia, and your other hand is going to be on the plantar aspect of the foot, and your patient is then going to dorsiflex. Then you can go ahead and test the patient bilaterally with your hand placement and patient placement the same. I would give both of these legs a 5 out of 5. A compensation you should be looking for is hip extension or hamstring activation. The soleus originates at the posterior surfaces of the head of the fibula and proximal 1/3 of its body, soleal line, and middle 1/3 of the medial border of the tibia, tendinous arch, and between the fibula and the tibia. It inserts with the tendon of the gastrocnemius into the posterior surface of the calcaneus. When manual muscle testing the soleus, you want to have your patient prone with knees flexed. Your hands are going to be placed at the anterior aspect of the tibia and the posterior aspect of the calcaneus, and you're going to have your patient dorsiflex their foot. You can then go ahead and test your patient bilaterally and have them perform the same motion with the same hand placement and the same positioning. I would give both these legs a 5 out of 5. Some compensations you should be looking for is any flexion of the knee or extension of the hip.